guests and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Good evening, everyone, and welcome to your Hometown Health Show. I'm Yolanda Santana, owner of Albits Tech and your host for the show. And good evening. Tonight we have as our special guest is Colleen Farron, occupational therapist, CDP, Regional Therapy Director of Trilogy Home Healthcare, our sponsor. And welcome also Jennifer Smith, Director of Marketing at Trilogy. Good evening to both of you.
Hello.
Hi, how are you?
I'm well. How are you?
Well, my dog, we were trying to get him out of the room, but he won't leave. So I'm just fingers crossed that he won't bark a lot. He'll hopefully just thank you for asking.
That's really tough. Well, you're our guest for the evening and a Trilogy alum. We're pleased to have you on the show. Could you please delight us and tell us a little bit about yourself?
I am an occupational therapist for almost 40 years. That's a really long time. My passion has been in the world of Medicare home care for several decades now, but I'm one of those therapists that did a lot of work in the psych field. I was a burns therapist for several years. I've been in outpatient, I've been in inpatient, I've worked on all kinds of units. So I have a nice blend of experience. Right now, I help to manage the day-to-day going-ons of about 150 therapists between 3 different offices. So I'm pretty busy. We have a lot of specialty programs that the therapists wade into, and so I have to stay on top of all of the breaking news about what's going on with Medicare.
Okay.
We're very lucky to have Colleen. Trust me. I love her to death.
I paid her to say that. Thank you, honey. I appreciate it.
So I know, and if any viewers that are regular viewers of our show know that Trilogy offers an array of services. What would you say is your favorite and why?
That's a tough question. And so really, I don't know that I can say I have one favorite. I have a few, though, if you don't mind. I'd like to share some of them.
Please do.
We have some pretty cool low-tech technology. One of my favorite things is a machine that's called a bioimpedance monitor. It's a monitor that the nurses put on patients above the sternum and below the sternum when they go to see them for those patients that have fluid imbalance problems. For instance, someone that might have congestive heart failure, all the way to the other end of the continuum for those patients that dehydrate a lot. And this machine is so precise that it can measure how wet or how dry the thoracic cavity is, and it gives us a heads up to let us know up to a few weeks in advance if someone's going to fluid overload or dehydrate, so that we can intervene in the home with medical supervision and direction from our physicians and our clinicians in order to keep that person there. So I love that we've invested in that. It's part of the cardiac team. When needed, we also have respiratory therapists that help to support those services. We do IVs in the home, which I have to say, if any of your listeners have ever had IVs in an outpatient clinic, it's way easier to have them in your home. It's so much easier if someone comes to you and helps. We also have certified psychiatric nurses and occupational therapists that go in and help people manage depression and anxiety. We give support to a lot of psychiatric practices that have patients that need injections monthly. And we're very well equipped to support those families that are dealing with dementia. Both Jen and I are certified dementia practitioners, so it's a real love of ours. We like being able to support that community. Additionally, we have certified wound nurses. We have a pelvic floor program for those folks that have incontinence. I teach a low vision class to a lot of our patients, to a lot of our therapists that have macular degeneration and glaucoma and all kinds of things. So I couldn't choose one. I was trying to encapsulate it there for you.
Okay, fair enough.
I was going to say something and I just forgot. For the psych nursing, I think it's more than ever imperative now during this global pandemic and also what's going on in the country on top of the global pandemic. And I deal with it personally as I am in an interracial marriage and my husband is also a police officer. So going through not only the global pandemic, but kind of what my family deals with on a daily basis. And then, my husband being a police officer, we're going through a lot psychologically and emotionally and having to educate our children. We've got an almost 7-year-old and a 5.5-year-old. So my husband and I have been dealing with a lot recently. And medication is helpful to me at times. I'm going to put that out there, but also being able to talk to someone. And I have actually spoken with one of our psych nurses, Jennifer, who is amazing and been very helpful in guiding me when it comes to even my children during these crazy times. So, I'm not of Medicare age yet, but it's very helpful for me.
She brings up a really good point. Not only do we have social ills and we have a horrible pandemic, but our older adults, the geriatric age patient that Jen and I deal with, are suffering because of social isolation. Those people that can't be seen because they live in a skilled facility or an assisted living facility, or those folks that get hospitalized and their families can't go to see them. The families that have older adults living with them, like us, my mother's lived with us for 20 years, we've had to be very mindful and aware of who comes and goes and how much hand washing we do, things that that have altered our lifestyle. There's anxiety, there's depression, people aren't sleeping well, people are drinking too much. I mean, the collective is having a physician that will ask for a psych nurse to go out to the home, someone that can look at the big picture, see how well you're coping, see if you're still managing medications, are you doing the bit of exercise that you have to do, are you eating well? This is critical, and this will keep people out of the hospital. This will keep those comorbid conditions that they have from getting worse. So yeah, between Jen and I think we've covered the importance of it. Big deal. It's a big deal.
Yeah, it is. And I'm, I'll put my age out there. I'm early 40s, but it has affected my health. And, Yolanda, I've always got this cough. I've got severe asthma. It has made it worse. It's not getting better. And I know that a lot of it has to do with the anxiety that I'm kind of going through with everything that's going on out there and dealing with all of that. So getting all of those like emotions and everything under control is definitely helping try to get my health together. So everything works as a package deal. If you're not taking care of yourself mentally, you're not going to do well. So it's really important that we as a company, Trilogy, we really look at all of our patients as a whole. And it's something that we take great pride in doing as well. So.
Yeah, that's wonderful. I mean, that's awesome that the company like Trilogy, you guys do that for the community, for your patients and everyone that works at the company as well. So how have you had to rely on telemedicine, and how do you see that working in what you do and with treating patients?
The pandemic, COVID-19, has caused Medicare, Medicaid services to change the way they do things. They have loosened the reins and restrictions on things that we've been asking for a long time. They finally have listened, at least temporarily. They've done a few things. First and foremost, we now have different types of clinical staff that can certify cases for us. Physicians, osteopaths, medical doctors, they've always been able to do it. But now Medicare has said, advanced registered nurse practitioners, and physician's assistants can be certifying clinicians. And the importance of that, I can't describe enough. But when we get referrals from physicians or from clinicians, we have multiple guidelines that we have to follow. And one of the things that we have to be able to do is something called a face-to-face. They have to have seen their physician within 90 days before coming on service and within 30 days afterwards, or Medicare doesn't consider the episode valid. Well, now the physicians can use and the clinicians can use telehealth as a certifying face-to-face visit, which just changed things dramatically. It's easy. Anyone that's done telehealth will tell you it's so easy. You sit in front of your computer like this. You're in your home. You don't have to go out and deal with anything. It's a very one-to-one experience. It takes a short amount of time. They're succinct. They work their way through it. So telehealth has been helpful to us for that. What we can't do as a Medicare Part A home health company is we can't bill for our own telehealth visits to patients. Medicare has said you can do them, but we're not going to reimburse you for them. You need to be able to go into the home to see patients. Well, we call our patients a lot. So we already have a type of telehealth that we do. But in the Medicare Part A world, we're not yet loosened enough in order to use telehealth. We, however, have a system called Cinzy that we use between each other. Let's say we have a patient that has significant wound on their leg. They're diabetic and they have a wound. We can have our nurse go to the home and she can turn on this HIPAA compliant Cinzy app from her phone, call the physician and show the physician in real time, HIPAA compliant, what the wound looks like, instead of the patient having to go into the wound clinic or to be seen. And then we can take orders based on what they see. So we're not using it necessarily for billing practices, but we're using it for very good quality care and best practices.
That's amazing.
I know, it's pretty cool, right? Yeah.
We're going to take a short commercial break and we'll be right back. I want to continue talking about that. All right? Stay tuned.
Yeah, sure.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Welcome back. Good evening, everyone. You're listening to your Hometown Health Show, and I am Yolanda, your host. Again, we have Colleen as our special guest and Jennifer Smith from Trilogy. We were just talking about that amazing Cinzy app that is HIPAA compliant. You were talking about how you can take live pictures of wounds, and that is amazing. You want to tell us a little bit more?
It's really, I know it sounds amazing, but it's very simple technology. It has an extension to it, the company that designed Cinzy also gave us the ability, family and patient approval, to email and text them. So we send out updates, we send out education on how to keep your loved one out of the hospital, and I don't know, low salt diets, you kind of name it. So it allows us to touch the families and to touch the patients even when we're not there. We're quite proud of it. We love it, but it's kind of simple, right, Jen? I mean, it's kind of low tech, so works for us.
Yep. Very
Works
simple
for us.
to use, which is the best part.
Right, exactly. Has to be simple. It's a bunch of women and men that are nurses, and we're not really necessarily highly technical. We're very medical, so it has to be simple.
Okay. All right. Great. So tell us, how did you get involved? How did you get into this industry?
Me personally,
Yes.
well, how did I get into this industry? All right. It's a funny story. Not funny, haha, but I am quite older than you guys. And when I was a young child, my parents got divorced. And I was probably the only divorced student I ever knew until I got to high school. And so there was strife, there was pressure, there was anxiety as a kid. My mother was a divorced woman in the Catholic Church, blah, 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 the whole thing. I got older. I went to college and I had a background in psychology. And I was able to connect and resonate with teenagers because, one, I wasn't that much older with them, but as well, in the early 70s, mid 70s, late 70s, many families had self destructed. There was a much higher rate of divorce than when I came up in the 50s and 60s. And so these were kids that were dealing with that in the fallout. We also had a lot more drug addiction. And so for 5 to 6 years, I worked with adolescents that were emotionally disturbed, that had horrible mental illness, that were just coming into schizophrenia. And I worked in lockdown units in state mental hospitals, which frankly, for the most part, don't exist anymore because we've gone ahead and put so many people into community health. And it was there, dealing with young adolescents and looking for a way to connect with them, that I became friends with one of the OTs that worked on the unit. And I was so impressed with how she was able to persuade kids that were floridly psychotic, that had visions and hallucinations constantly, to calm their minds enough to sit down and to do some craft activities, to pay attention to an activity for 5 minutes or 10 minutes instead of standing in a corner and banging their head. And it was, did you ever have a point in your life where you felt a light bulb go on? And I said, this is it. This is what I want to do. So I went then to OT school. And once I figured out that I could get into the medical realm instead of just the psych realm, I kind of just blended the two of them throughout my life. So an OT is a good fit for me. I'm emotionally, psychologically aware and interested in treatment. I'm also sort of physical, and I like to do exercise, and I love activities, and I like crafts. I can communicate. Anyway, it was just a I don't know. It all came together. Just was at that point in my life where it all came together.
She's a natural teacher. So
Yeah. It's not too exciting, but but that's my story. And interestingly enough, as your kids get older, my oldest has been working in community mental health in Norfolk, Virginia, with really cognitively and socially impaired people. Has travels from house to house and helps them and takes care of them. And now she's in graduate school and she wants to be a social worker. So in some ways, the apple didn't fall far from the tree. The other one is a hairdresser, and she's all things arts and arty and fashion and makeup. And clearly, that was not me. So,
Well, hairdressers are kind of, therapists as well. So
yeah,
it's not that
right. You're right. They are. They are for sure. For sure.
very much. Very much.
So how can people get a hold of you? How can they contact you?
Me personally, you would go through Jennifer for all that. I am part of the management team. But I think that what we need to make sure of is that you know that there's an office in Broward, Palm Beach. We actually have 10 offices throughout the state. But in this particular area, it would be Palm Beach.
Okay.
So you can get a hold of Jen and she can get a hold of me.
Yep. But our Broward office number is 954-689-6660, or you can just call me at 561-670-9213.
Fantastic. And is there anything else you want to tell our listeners and viewers, especially dealing with the pandemic and everything that's going on out there? Maybe some tips on how to stay safe or what to watch out for health-wise?
Well, I think that what's important to know is that in order to rise to this occasion, Medicare has let loose some of the restrictions. And one of the restrictions that they have loosened is the access to home care. People don't have to be as significantly homebound as they used to. If the physician says that the patient is medically fragile or at risk of contacting COVID, or if they have COVID, but perhaps aren't horribly ill but can't get to outpatient therapy, we can extend services for them. That's a very big deal so that people don't have to go out and about into the community. We are a company that's always been very mindful and aware of infection control. I feel like we're all on steroids right now in terms of infection control. And thankfully, we are completely prepared with all kinds of supplies in order to take care of patients. So with the amount of COVID cases increasing dramatically in South Florida, you probably have seen some of that as well yourself today. I'm expecting that we'll be getting more patients. The ICUs and hospital beds are not as numerous as they were. So we're as prepared as we can be for this.
That's great. That's really good to hear. What would you say to people who have to go out there and can't work from home and obviously, the elderly,
right.
if they have to out and do shopping?
Wear a mask. Don't listen to any of the craziness.
No.
Wear a mask. Wash your hands. Use a lot of hand sanitizer. I was at Publix today with my mother and regular bottles of hand sanitizer again. Keep sanitizing wipes with you. Social distance. Don't get close to people. We need to listen to the experts, not the crazy realm of people that say things that aren't helpful.
I actually have a whole kit in my car, and it's got it's a whole bag, and it's got gloves and hand sanitizer and a can of Lysol and alcohol wipes and my masks. It's like an entire kit that I created from myself, my husband. I've even taken pictures, sent it to our reps, and I just said, you all need to have this in your car so that you're never without. Right. So just get in the habit.
Is that what you're doing as well? Yolanda, are you doing that too? Yes.
I actually have hand sanitizer. I have several masks. What would you say? Because sometimes I have to reuse masks. Other than washing them, I also have certain ones I'll spray down with alcohol. What would you say to that?
Yeah. I think it depends on what the material is. Honestly, It depends on what the material is. Some of the N95s you can use and reuse, others not so much. Masks are so much more available now. Just have a bunch of them. Have fun with them too, I think. Have fun with masks, right?
Yes. Yeah. The cloth ones, they say you should wash every day. Like after you've used it for the day, you should wash it. So.
Right. There you go. There you go.
Yeah, definitely. Those are all really good tips. I hope everybody's listening, and I want to thank you both for being on to this evening. Thank you, Colleen Farron from Trilogy and Jennifer Smith.
You're so welcome. You're so welcome.
Absolutely.
Thank you. Anytime, let us know.
It was great to see you, Yolanda, and thank you, Colleen, for hopping on with us. It's always a pleasure. She's a great educator. So,
you want to drop your number one more time and website?
Sure. The office number for our Broward office is 954-689-6660. You can always call me directly at 561-670-9213. We have offices throughout the entire state of Florida, and we do cover from Broward all the way up to Jacksonville. So but it's only the state of Florida. So any Medicare recipient, we can pretty much take care of you. So just feel free to call. We're happy to help in any way, shape, or form.
All right. Well, thank you both again. You've been listening to your Hometown Health Show. I'm Yolanda. And join us again next time in 2 weeks, Monday at 7.
Yes, we look forward to coming back.
Have a great evening.
Thank you.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding sponsored program were strictly those of its host